Economics is a bit like nuclear physics. It has a huge influence on our life, but very few people understand it, and very few people can communicate what's actually going on. There are two people who qualify for the Stevens-Hawkins title of macroeconomics. One is Kenneth Arrow, and the other is Thomas Rice. And Thomas Rice, from a health economics point of view, is probably the most accessible, very serious economist. Kenneth Arrow is a superstar, widely acknowledged by his colleagues. He's the author of many books and a Nobel Prize winner, and one of his papers is actually on healthcare. It's a paper he wrote with Richard Peto called Saving Lives, Buying Time, Economics of Malaria Drugs in an Age of Resistance. So this is a very powerful note that he's done, but usually he's working in more general fields of economics. And the book that we've recommended as one of the 10 key books to understand value is something he wrote in 1977 called Social Choice and Individual Values. The key quote from this is, and I'm quoting now, "In a capitalist democracy, there are essentially two methods by which social choices can be made. Voting, typically used to make, quotes, political, quotes, decisions, and the market mechanism, typically used to make, quotes, economic, quotes, decisions." Political decisions and economic decisions in a capitalist democracy. How does that relate to what we are trying to do in healthcare? Let's think at the moment about decisions about groups of patients or populations. People with rheumatoid arthritis, for example, or people with dementia. One approach is what you would call the economic approach, and that is a market for services for people with dementia. Exists to some degree. There are private nursing homes, but we have regarded it as a social value to ensure that people with dementia will receive a basic level of care, and that's a political decision. There is, however, a hinterland between politics and the market, and that is where the bureaucracy occupies a place. Because really, it's not a matter that people vote for more money to go into dementia or not, although diseases are occasionally used by political parties, sometimes dementia, sometimes cancer, sometimes childcare, as a means of attracting attention. But usually, in a capitalist democracy, it's not actually left to the market to decide. It's left, more or less, to the officers of the state. Now, this varies from one place to another. In Germany, for example, there are competing insurance companies. In the United Kingdom, there are competing hospitals, but not competing insurance companies, because primary care trusts, clinical commission groups, they manage the resources that the political process has allocated for healthcare. This then requires that the political process chooses a particular type of bureaucracy. In my view, it doesn't matter very much, but that's what they do. The bureaucracy then has to make judgments on behalf of their political masters, even though they haven't clear guidance. For example, should they put more money into rheumatoid arthritis or into bronchitis? Should they put more money into childcare or care of elderly people? And this is where judgment is required. And, of course, judgment on the part of officers who work for a bureaucracy, who work for a politically appointed government, it has judgment. And the judgment has both factual and ethical elements, as Herbert Simon pointed out in his analysis of judgment. There are important ethical issues. And actually, the facts on which the bureaucrats who work for the politicians have to make a decision, and I speak as one of them, the facts are rarely completely clear-cut. So when we look at the choices that are facing us, is it really as stark as voting and the market? I think actually, in my view, there are three methods. There are political, market, and let's just call them public sector bureaucracy. And I use the bureaucracy in the good sense of the word, namely a mechanism for managing money uncorruptly and openly. You might also like to look at Herbert Simon's book, Administrative Behaviour, for a discussion of the relationship between politicians and officials, and also Mark Moore's excellent book called Creating Public Value. And here are three questions for you to think about. Where should the market operate in healthcare? Obviously in the manufacture of computers. The state should not do it. But what about the market operating in the provision of back office functions like finance and human resources? What about it operating in terms of insurance companies? That's part of the market. In America, the insurance companies are very much private sector companies. And does it make a difference if the market operates in terms of delivering patient care, as long as the citizens have access to care when and where they need it? So what is the role of the market in healthcare, in your view, wherever you work? Secondly, what do you see as a political decision? And what are the hot political decisions at the moment? Is it to do with the amount of the GNP goes into health? Or the amount of money goes into public sector? Or the allocation formula? These are social choices. And thirdly, if you were rewriting Ken Arrow's phrase about the two methods being either voting or market, how would you describe the sort of work that most of us listening to this do? Clinicians and people who pay for and manage healthcare. Are we making political decisions or market decisions or something else? Those are three questions to ponder.